Yeah, I think we can begin. Hello and welcome everyone to today's interactive session related to generative AI assisted medical diagnosis. I am Anitya Gangude. I am the head of product and growth at here at Medista. And Medista is we are trying to build an ecosystem that is catering towards multiple key players of the healthcare ecosystem, them being patients, doctors, and um, insurance payers. And we have built certain technologies right now that are catering towards all of them. And multiple applications have been launched by us right now. In today's session, we will primarily focus more on the generative AI assisted medical diagnosis. We will look into some of the applications of AI. Then we will also cover into the details of CDSS and how AI is affecting or impacting the CDSS tools. Um, and to delve more deeper into the topic today, we have Dr. Nitin Thomas with us. Um, Dr. Nitin is an emergency MO and assistant medical director at JK Hospital in Kerala. He has been a staunch proponent of use of technology and AI into medical practice, and he keeps an expertise and enthusiasm towards AI-powered systems for medicine. Thanks, Dr. Nitin, for joining us today for this session. So,
Thank you.
yeah,
Thank you. Thank you.
hi. So, Yeah, we can begin with the today's agenda. This is the agenda for today. We will cover some of the basic AI related applications, dive deeper into the generative AI side, look into the CDSS based Gen AI applications, and also look at one of our own applications that we have built, which is also a Gen AI powered tool and how it is impacting. We will look at some of the use cases with that tool and look at some of the questions that our audience might have. Basically, we will look into those things today. Um, so AI as a core field has been really relevant into multiple industries, and a lot of applications have come out in the last 2 decades itself. Healthcare was not left out. Healthcare has also witnessed a lot of such applications. So most of them revolve into your computer vision based applications. So that is diving deep into your image analysis side, where AI is able to detect certain patterns within radiographs or various other images. Then in robotics, we have certain use cases with AI through reinforcement learning. And then based on some of the other use cases that are applicable towards generative AI, there are more such applications that are coming out now. Um, so basically, overall, with time, AI is becoming more and more critical with healthcare. And there has been a trend notice that a lot of money has been put into this particular field, which is AI in healthcare. A lot of research is happening, and a lot of applications are coming out. So it has been noticed that around 38.5% annual growth rate has been marked down throughout this decade. And we will see by end of this decade, or by the beginning of the next decade, we will have around 355 uh, billion US dollars invested into this market. So that is how big the impact or the money that is being put in has been. And yes, based on that, a lot of applications and use cases will come out. So and the impact has already we can already notice the impact. So as per Harvard School of Public Health, they had published one research, and an increase in accuracy has been noticed already with the tools that are doctors are leveraging AI models such as your radiograph based image analysis models or your generative AI tools, and they are noticing a significant impact in their diagnostic accuracy. Now, this is also getting translated into your treatment based costs, and 50% of the money is being saved in that regard as well. And 40% you are like patients are noticing like there are 40% improved health outcomes also on the patient side. And overall, this has also led to multiple applications on the administrative side where billions of dollars are getting saved every year just through AI applications. So that is what the impact has been. And if I just glance over some of the applications that are already have become mainstream. So those applications are like your critical radiograph scans that you have. So analysis of those scans by using computer vision models. So that is one critical use case. There are some other applications such as predictive analytics or forecasting. Now, suppose I have a particular health-based data, I can feed it into the model and let it predict the next step or the next issue that might happen. So that is how the model is also being trained with AI. We also have AI in tumor detection. So this is more of a again a similar application with computer vision, but this can also take all the medical information of a patient from their scans to their past history and then predict the next whether they will develop a tumor or they have a tumor right now. So from the images and the scans. So that is one application. We have personalized medicine with AI. So this is again considering AI and the patient data. So the AI uses a lot of data. So in that regard, it is able to generalize and create a specific personalized solution for that particular patient. And that also helps with better outcomes for that patient. We have virtual health assistants. So that is one application that Medista has also been a key proponent of, or we have developed certain solutions that are virtual health assistants. You can basically call them that. And then yes, robotics for robotic surgery. We have AI enhanced robotic surgeries, which also use a lot of AI. Now, this is more of a general application. So to explain further on the generative AI side, I will hand over the session to Dr. Nitin. So yeah, Dr. Nitin, please go ahead. Yeah.
Yeah, thank you, Nitin.
Thank you, Nitin.
Thank you for
Thank you.
that is a real application of generative AI. So what are the key characteristics of this technology? First is, as we are told, generate synthetic data. So generating essays from ChatGPT, we seeking advice from the diagnosis platforms, etc., or generating images. All these come under this technology. What is significant about this is that it learns continuously for real-time insights. So we don't need to train it from the scratch. If we are seeking some advice for a patient, it can analyze the already available data of clinical research, its previously analyzed reports and all, and help us with the insights. Next. So what are the general applications of Gen AI in healthcare? First of all, it can boost the diagnostic accuracy for our treatment. Second is the adaptive decision making. So first of all, we are feeding these Gen AI applications with our already researched tools. And then it can provide realistic outputs. Then for patient education, each patient will have different needs. So it can, based on the available data, it can give personalized suggestions for patient education. Also, we can use it for synthetic data generation. So how is it applied in healthcare? So yeah, while we are working, most of you know, while we are working in our hospitals, we if we are taking an X-ray and submitting it to the these applications, most of it will not be clear. So we need to train these applications with different types of images. So we create some synthetic data based on if there is a consolidation or there is a pneumonia, we create some artificial X-rays based on that and train on that. All these come under the Gen AI. Next. Now let's look at some applications. We will see one such application. We have NVIDIA Monai. Actually, it is an open source platform, basically meant for the AI.
The latent diffusion model is a breakthrough in generative AI for medical imaging and is being developed by King's College London, co-founders of Monai. This model can generate synthetic medical images of the human anatomy, including high-resolution brain images. It was trained on the UK Biobank dataset.
Yeah. Clinical decision making. This is our main topic for today. It's actually based on the generative AI that we have discussed already. So any of you have used this CDSS tool or clinical decision support tool? Any of you have used it?
No, sir. Can you show that, sir, if possible?
Yeah, we are coming to it. But have you ever used this Medscape or UpToDate? The disease and drug sections of Medscape or UpToDate? Do you know UpToDate platform? The CDSS, that is Clinical Decision Support System platform, UpToDate. Yeah, so we will explain. Next slide, please, Satya. Next, please. So what is CDSS? CDSS is a clinical decision support system tool. So what are we doing in CDSS? First, it's a digital evidence-based clinical information is fed into the tool. Then it can provide the diagnostic assistance and treatment recommendations. So if we can provide the patient notes, X-rays, images, ECGs, etc., it can provide the diagnostic assistance or the treatment recommendations tailored for each patient. Moreover, it can provide the patient education material. Most of the patient, while we educate the patient, each patient needs will be different from one another. As you are told, UpToDate is a popular CDSS. CDSs are of many times there are standard CDSs like what you are told, UpToDate, and there are Gen AI tools like the Medista and all. So Healthsphere and all. So we are coming to it. Next slide, please. So why CDSs? What is the use of CDSs? It's aimed at primarily to improve the patient care and outcomes, to increase diagnostic efficiency, and to reduce medical errors. So if you have a standard material to advise at any time, accessible anywhere, we can provide accurate dosages to the patient. We can dwell on accurate differential diagnosis and advise the patient what all to do, what all not to do, and etc. Also, it results in increased diagnostic efficiency. Many of the time, we may miss minute findings in X-ray, CTs, and all. So with the clinical decision support systems, what we can expect is that by taking advice or taking leaps from this technology, we can improve the patient care, diagnostic efficiency, and reduce medical errors. Next slide. So what is the difference between the conventional diagnosis with the basic CDSs, and diagnosis with the Gen AI powered CDSs that is a topic of discussion today? First, we will analyze what is the conventional diagnosis. And conventional diagnosis requires a manual search and review of data across various sources. So if you are doubtful about a case, we for medical cases, we will refer Harrison. For surgical cases, we will refer Bailey or something. And the output we are expecting is highly dependent on the doctor's experience and knowledge. So we cannot expect the same level of output from every doctor. So it can result in extended diagnostic time and potential delays. So if we are in front of a patient and we cannot go and refer to all the books and all. So there is a ready reckoner accessible everywhere in our laptop, in our phone, in our EHR. So that should be available. That was with the UpToDate, Medscape, and all. We bridged that gap. So how was it beneficial? It consolidated clinical data into a single accessible platform, and it offered validated evidence-based guidelines and references. So if we want to check on myocardial infarction, we go to the Medscape or UpToDate, and we will see the guidelines. So what is the latest guidelines? It's all there. It's all there in that treatment guidelines. But the difference is that the difference between the conventional diagnosis is that it speeds up the diagnosis by organizing and prioritize information, and it can also easily integrate to EHR to provide relevant patient history. As it is digital, we can integrate it to our existing systems. Next slide. So how does it compare to our AI-powered CDSs? How does the standard CDSs compare to AI-powered CDSs? In standard CDSs, we require clinician input to locate relevant data. So if we need to search about a disease, we will go to that disease section. And if there are any contraindications of any specific drugs used for that treatment, we will again dwell into that. So much time is wasted on that. They are basically static. We need a dynamic tool. That's for each patient, for each different patient, we need different treatment modalities. So that's what we are achieving with the AI-powered CDSs. So AI-powered CDSs analyzes and suggests relevant data based on patient symptoms. So if we can input the patient's symptoms and all, and relevant data, relevant blood information, relevant X-rays, ECGs, etc. It delivers real-time analysis and updates based on the live patient data. So even if a patient is in front of us, we can use the platform. So we can ask like this. If we have encountered so many such cases in our clinical practice. For example, if if we get a referred patient from another hospital, he is in urosepsis or sepsis or anything like that. We have already, so the referred hospital have already used some 3 or 4 antibiotics. So what does the current guidelines say on what to do next? Which antibiotic to use next? So we cannot refer to all the medical records, all these sections, and decide. So with the AI-powered CDSS, we just as a conversation, we can input the thing. So and so patient has come with the urosepsis, and he is presently in multi-organ dysfunction syndrome. He has already on so and so antibiotics. So what can we do next? What should we do next? That's the power of the AI powered CDS. Also, it can integrate with the medical records to personalize recommendations dynamically. So each patient will have different diseases. Some will have diabetes, hypertension, and multiple disorders. So based on the patient condition, the AI powered CDSs can provide relevant output. That's the difference basically from the standard CDSs.
I think someone is raising their hand. Raj, Dr. Raj.
Dr. Raj, you have any questions?
Okay, yeah,
No,
maybe
okay.
it was a mist. Okay.
Yeah, next one, please. So, so as you are told, the main advantage is that rather than the static recommendations that we have all been experienced previously, we have been able to deliver dynamic insights based on each patient's conditions that support more accurate and, as I told, personalized decision making for the differential diagnosis, for generating a treatment plan tailored for each patient. We can do with this clinical decision support tool, this AI-based support tool. Next, please. Yeah. Now we will explore some examples of this Gen AI in healthcare CDSs. The 3 examples I have chosen. The first one is NVIDIA Clara. It is basically a radiology platform with synthetic data generation and all. So anyone can use that. And basically, if we can provide a CT scan, MRI scan, X-rays and all, it will it can identify the disease condition in that. But it is not a pure properly CDSS where we can where the advices of treatment recommendations, etc., will be given. In IBM Watson Health, basically it's an oncology platform. So it delivers oncology treatment recommendations. The third one is Healthsphere by Medista AI that we are exploring in a short while. It is a purely advanced Gen AI offering personalized insights. Next. So we will watch a demo by Anitya about the Healthsphere interesting application.
Yeah, thanks, Dr. Nitin. Yep. Yeah, so sorry for that small issue, technical issue on the echo side. So I will just showcase one of the generative AI applications. I hope I'm audible properly now, right?
Yeah, you're audible. Yeah.
Okay, so I will just showcase one application that we ourselves are developing, which is more into the generative AI side, and it has been like through our months of research and feedback from the Indian doctors as well as international doctors, and some of the people are also present on this call who I've like talked with and kind of been on their back to get more feedback on this thing. And from that whole research, the Healthsphere tool has come out, and right now it has been made public for everyone. It is also available as an application, mobile application. So right now we are making it available on cds.medista.ai. So completely free. Anyone can use it in their professional practice or just for their just to try it out. You can use it right now. But Healthsphere is taking it all that generative AI based technologies and putting it in one place for the doctors. So I will just quickly sign up, and I can even do that with Google. So quickly, I'm just logging in. Okay. So as Dr. Nitin was mentioning, so with generative AI, what we have done is we have taken a lot of medical literature that we could find, millions of data points, and various guidelines and various researches and various references. All of those things we have taken the consolidated research, and we have trained the models on top of it. And now this particular generative AI model that is deployed in the backend, this has all that context in its mind. So it is more acting like a AI assistant for you now. With all the references and with all the clinical guidelines any CDSS tool might provide. So yeah, so this is on if you come on this healthcare application. So we have a consult page. Now here I can quickly ask any of this, smaller questions that I might have that I just need a quick answer to. So instead of reading it out or referring some other sources, here we have like a quick reference tool over here. So I can just type it out, and I can even further ask any other question to it. But that is how I will just type any question, and within seconds it will be able to give out that explanation to me. So I'm just asking it a very simple question: target blood pressure range for patients with hypertension. So very simple question, yeah, and it is able to reference that information from its database and put it in front of my screen. So that is the power of generative AI. Now it could be any other question, like very difficult question as well, which is highly like related to my specific use case that I'm dealing with right now as a doctor. I can add that as a question. So here it is: when is surgery recommended for appendicitis? And yeah, with the same power of that generative AI, I'm able to generate out or get the specific information from the model's understanding. And if I need to understand it further, so this is where the interactivity also comes in with generative AI models, that I can just ask a follow-up question on top of its results. So I can just say like, what is acute appendicitis? So this is what it has already outputted. So I will just further ask it a question, and it will keep on answering on that particular topic further. So that way I can build an understanding of whatever diagnostics I'm doing at that time. So that is the power generative AI gives to me. Um, so that is a simple use case here. What we have also added is this like building on top of it with differential diagnosis, diagnostic plans and treatment plans. So if I have a patient case, I can quickly, so these are some of the examples we provide to just, to get started. So I can select any of these examples, and I can add more details if needed. Let's say I select this example, and I will just send it. So within seconds, it will generate me a differential diagnosis report. So this will contain all the differential diagnosis related information for this particular patient case. It will also generate me a reference assessment and plan. So this is more of my treatment plan that I will get here. And then it also generates patient education. So patient education is, so we'll look at patient education, but let's look at this differential diagnosis report on this patient case that it generated. So it is mentioning all the details that it has right now. So a 72-year-old male with sudden onset weakness and numbness on one side of the body. And it is also mentioning that what things it doesn't have right now. So travel history, past medical history, surgical history. So it can use all of these data points to create this report, but it is now right now going with what it has. So if I go more into the details, so it is going to suggest me the most likely diagnosis. So here are the three diagnoses that it is saying that this patient might be suffering through or is kind of having these three issues right now. So it could be your ischemic stroke or hemorrhagic stroke or this transient ischemic attack. So any of these three issues are most likely the cause of these symptoms, and it is explaining in detail also, like very small details on like this particular issue. What is the missing information? What kind of a scans do I need to make? All of those things are being given here. It also builds on top of that differential diagnosis. It further explains like it could be even be seizure, your brain tumor, or multiple sclerosis. So that is what it expands further on. And then there are also can't miss differential diagnosis that you should also keep in mind that this could also be that issue. So within minutes, I'm able to, or within seconds, I'm able to generate that particular report just from this patient case. So that is the power which generative AI gives to the medical professionals. It also gives out uh, so like there has been with generative AI, the hallucination and whether the information is right or wrong, that is a critical challenge with like even with like large companies. And what we are doing to solve that is we are providing the sources as well for that information. So that way it is like sure doctor is sure that this information is 100% like accurate or from referred from published references or sources. So if you move on to the second tab, here this generative AI is able to give you the diagnostic plan. Now I had this ischemic stroke as the issue. So for that one, it will give me a diagnostic plan on what should be done. So CT scan of the head, it is saying, MRI of the brain, and carotid Doppler's ultrasound. So for ischemic stroke, that is the diagnostic plan. And then there is also a treatment plan that it is suggesting. So it is saying like antiplatelet therapy, some supportive care, and some monitoring related suggestions. For same for the hemorrhagic stroke and for this TIA. And it is also going to give me some more for monitoring and follow-up suggestions and long-term management. Now here again, the interactivity comes up with generative AI. Like for example, I need to just get understanding on, I need more understanding on antiplatelet therapy. I will just ask that as a follow-up question. So as there is no manual research you need to do with tools such as HealthSphere, the model goes and grabs that information for you right whenever you need it. So it builds on top of that antiplatelet therapy. So anytime I'm like doing certain diagnostics, and whenever I need certain help with certain issues, I can quickly refer to um, any generative AI tool such as HealthSphere. So yeah, so it is explaining it further, and I can keep on talking with it forever. And basically, I can solve that particular issue or get more details about that issue for that patient case. Now with patient education, so this is also the power, again, the power of generative AI, where the model, it is able to make the same information um, easily understandable for different audiences. So for doctors, it is going to use those medical terminologies and go into very details. But for a patient as well, it will explain the same info, but in very simple terms. And it will also generate some of the care instructions on some of the other needed medical information for that patient, follow-up care. So all of these issues, all of these points are getting mentioned to the patient. Now, a doctor can share this with their patient. Another thing that comes up because of generative AI is multilinguality. So whether I'm in Maharashtra or like in Telangana or in Gujarat, I can convert this information into that language with generative AI and specifically cater to that audience or those patients speaking that dialect. So that is how personalized generative AI can get. So yeah, so that is basically on the patient case side. Um, Now, another point that we have also added into HealthSphere, which is the multimodality of generative AI models. So, as I said, that generative AI is just your similar to kind of a AI assistant having kind of this human-like brain, and just like how we can understand images, text, audios. Similarly, generative AI models do the same thing. Um, like for example, we have this feature over here where I can simply upload like suppose I have this ECG scans with me. So you can see. So yeah, I will just upload this ECG scan. This is the ECG scan I have right now. And with multiple doctors that I've talked with, they have always said that reading out the ECG reports has been is like always kind of difficult for the junior residents and the younger doctors. So that is one feature we are also providing in HealthSphere, where our models are able to read out the image as well as understand the patient case. So I can simply say for the sake of the demo that explain this ECG report for a patient suffering with, let's say, TB. So I'm providing it with text. I can add as much details as possible. And even with this report supplemented to it, it will understand the report and also take in this consideration that the patient has TB. Yeah. So it has gone through that report, and it has mentioned some of the ECG based, I'm not sure about the details of this one, but ECG leads and some of the additional information. And it has also said, like, inference wise, it is saying that this does not include any specific findings or interpretations, but abnormalities can indicate issues with arrhythmias or ischemia, cardiac or some cardiac conditions. And it is also giving potential diagnosis based on that report. It could be your arrhythmias or myocardial ischemia, hypertrophy. So yeah, it is presenting all those conditions based on whatever input I gave and some of the medications it is suggesting and also some recommendations. So that is basically the flexibility that generative AI offers, that you can upload an image as well as a text, or even if you have audio. We don't have the audio right now, but yeah, we can maybe think about it. But any kind of a data we can provide, and it is able to reference back in its database and give out the answer to everyone, to the medical professionals. So that is the power. I will just go back to the slides. Yeah, just a second. So I will just quickly go over this, and Dr. Nitin then can continue. So comparing this HealthSphere tool with UpToDate, as you all, most of you I think must be aware of UpToDate. it's more of a manual reference tool that doctors worldwide refer to while building up their the diagnosis and differential diagnosis. How it differs with healthcare or any generative AI powered tool is that we are AI. This thing is more of a AI powered machine as compared to just more of a manual search. So it's like a find versus search approach. With up to date, you have to go and find particular information, and it's another like typical manual finding or research skills are needed in that case. With healthcare, it's more of a kind of a find approach, so where like you are able to just demand that information and it is presented to you in front of you. So healthcare is doing that, and up to date is more of a you go and manually do the work. So that is the difference, key difference. If you talk about the reports and charts, tools such as healthcare do integrate or make that as a main part of their applications, where you can upload those images and records and build the model's understanding, and the model is able to react better that way. With up to date, we don't have any kind of a report based uploading or any interfacing based on the reports. Healthcare is interactive. Yes, generative AI are very communicative and interactive in that sense, and you also saw it live also right now. Up to date is none, like doesn't allow that. And basically those are differences. And on the other hand, if we talk about the cost side, up to date is a really costly tool, while tools like even with healthsphere, we are right now offering it for free to everyone, and it will be a kind of free offering for quite some time. So please take a kind of use that. And but up to date is quite heavy on the cost side, so that is kind of critical differences. So I will hand over back the session to Dr. Nitin for his conclusion on the generative AI topic.
Thank you, Anitya. Thank you for the wonderful demo of the tool. Why Gen AI is transformative in healthcare? Seeing the demo, what I felt is that it's the main thing I noticed is that is efficiency and personalization. It's reporting spontaneously. It's reporting in if we ask a question to it, if we submit some reports, ECG or anything like that to it, it's generating the real-time reports. So in the middle of the night or something, if some junior doctor is confused about an ECG or X-ray, obviously sometimes we cannot reach the senior consultant. So in that scenario, if that junior resident is in the ICU, he can just upload it and generate the real-time update or real-time report regarding that. And it delivers patient-specific recommendations. Here, Anitya has showed that if we are uploading an ECG, he showed us that we can ask if a patient has TB or if a patient has previous myocardial infarction. If a patient has previously a myocardial infarction or heart attack, we all know that there will be some ECG changes. So if we can demonstrate, if we can mention that also in the text that we are giving it, it's efficiently giving the realistic output based on the patient condition. Also, the accessibility, we can do not need to go to the laptop or any other center or to the libraries to see the books. We have our mobile phone in our hands, so we can just upload it, and in the real time we can see the results. And as the medical guidelines or the recent medical guidelines are integrated with the platform, the results will be accurate also. So it acts as a trusted assistant. So if we have a partner with us, we can definitely ask them what's your opinion, what's the differential diagnosis, what's the treatment you are suggesting. So that all can be real time, that all can be realistically and real time we can get from this platform. So the outcome is that it empowers clinicians to make informed decisions and ultimately our aim to improve patient outcomes. Next. So there definitely are certain challenges regarding the privacy, the bias. So in one area, there may be one guideline, in another in Europe, USA, India. There are different guidelines. There are some bias regarding that. There are different standards of regulatory compliances. Then slightly different outcomes might come. But regardless of all these, we can, as we have told, we can make use of this platform to improve the patient care. Anyone has any questions, please?
Yeah, the attendees, I think if anyone has any questions, please feel free to bring them up, and or we can have even a discussion on some of the topics we discuss right now. Yeah.
I have a question actually. See,
Yeah.
whenever we upload the patient X-ray or something, so the patient privacy, the data is being uploaded, right?
Yeah.
So is it not a breach of privacy? And because it is available on the web and everything, if patient is not happy, is the
Hmm.
information being putting on the AI on the web?
Yeah.
So is it
Yeah.
not a breach of privacy?
Yeah, that is a good question. So I can answer that. So what we are like, if I could just speak for healthcare right now. I'm not sure other tools how they are dealing with data. How we deal with it is like, whenever you're done with that session. So the privacy breach only happens when you are storing that data and you're sharing it with someone, right? So either the patient has to give a consent that I'm sharing this data for my own benefit. So that is the consent that they give, and that is why they share it. Okay. But if I, as a third party who is taking that data and sharing it further, then that breaches that contract. So that is where the privacy issue happens. What we do with healthcare is, yes, you said that when we upload a report, all that patient data also goes to the model. But what happens is, within that session only that particular information is used, and with us we don't save that data in any way. Like it's not of any use for us also in any sense, or so that patient case is just being used for that particular instance and then kind of removed from the system. So that is how healthcare deals with it. I'm not sure other tools deal with it in various other ways. How healthcare does it is we just refresh that session. Yeah. So that was a good question on the privacy side. Yes.
Yeah.
And as far as I understand, see the generative AI or anything, it is programmed, right?
Yes.
So how do
Mhm.
you keep updating by giving? Does it not take these information which we are sending in the scan and just included
Yeah.
in the
Yeah.
program AI language model?
No, no, no. It doesn't work in that sense, because we initially train the model, right? And we provide it with some data, which is like, available, whichever data we are able to grab, we just provide it to the model. It trains on it. It builds that understanding. And once we deploy it, it's not learning based on that data, which, a doctor might share. What happens is, suppose even if I want to train the model on that data, I need to instruct the model that, use this new information and kind of place it somewhere in your context. So in that sense, it is not learning at that time. But now suppose if some new research comes up or some new development happens in the medical fields, and I have those research papers, and the training process is completely different. So I can upload those papers or that information in the model through some other way. But while you are talking with the model, or while this scan thing happens, when it is processing that information, it won't use that information for training itself, because that is a very challenging process and a manual process kind of, and it requires some human effort. Like you need to set some doctors or some validators for that to validate that information basically. So it won't train on that data. Yeah.
Okay, what is the app name?
Yes. So it is called Health Sphere. It is like we just made it available on Play Store as well, and if you want to use it on desktop, it is at cds.medista.ai. Did you get the names? Or I can share it to you also. 1 second. I will
So
share it
till
in the chat. Yeah.
so which till the date this platform will be free. And another thing is this platform can be used by Ayush doctors too, or it is only for allopats, or is there any differentiation for that?
So sorry, can you repeat it, for which doctors you asked? It can be used.
Uh, yeah, can it be useful for Ayush doctors too?
That
For
he is
Is it only
asking
for
anything for homeopathy,
Ayurvedic. Right,
Ayurveda,
right.
yeah.
Yeah, yeah,
It can be
yeah.
used for that specialty also, or it is specific to the allopathy. That's the question. Yeah.
Yeah, yeah, got it. Yep. So we had been asked that question before, and for the Ayush, it is not like specifically fine-tuned for that particular branch of medicine, Ayurveda and homeopathy. We have not like specifically made it for that those branches, but in various ways it could be used. So like right now, I'm talking with this Ayurvedic hospital near my home, and they have found out like healthcare to be very useful for them as well in various ways. So even though they are an Ayurvedic hospital, they are being able to use HealthSphere in various ways to understand the issues or just get an understanding on the patient case. So those things. So yeah, in that sense, it is helpful, but not like specifically fine-tuned for them. So yeah, Dr. Chandrasekhar, yeah, please go ahead.
Thank you. In fact, it was a wonderful presentation. As you
Yeah,
know, that I'm from Ministry of Health,
yeah,
and as a tool, it is a wonderful, experience because post-COVID, government is trying because when we all face the bed shortage, etc., we are working on illness to wellness. That means my wellness centers are going to be the screening so that I don't overload the hospital. And
right.
this happens to be a wonderful tool. The
Mm-hmm.
only problem which I have seen, because I have used your software, first is
Okay.
I want to know that these are generally data driven.
Mm-hmm.
And where you pick up the data that actually derives, like particularly most of the AI things are supported by either European or US based.
Mm-hmm.
And the problem we face when region wise, we have the diagnostic parameters. This based on its regular, database and the methodology set on that software will diagnose. I'll just give you an example. I tried an MRI scan of meningium
Mm-hmm.
and it was not able to give me a direction.
Okay.
And instead of very specifically pointing out, and I tried different scan. Similarly, I tried one of the skin related issues also. Then even the medication, etc., I have to put it on the thing. But it said, okay, this is right, this is the right path. So what I could find, generic, it doesn't go so specific as you had mentioned about the, particularly in your demonstration or even in the radio diagnostic, which is a major thing. Because whether Ayush or anybody, everybody depends on the diagnostic. And same way, when the correct diagnostic comes in, the mode of treatment can be correct.
Mm-hmm.
And during the COVID time, we also found a shortage of testing laboratories. So the cloud-based testing machines have been established in various districts of the country.
Right, right.
And it's, almost 50 plus tests can be done in that. And these
Okay.
are all sensor based. And we had also seen sometime, the people move the machine here and there and the sensor gets disturbed and it gives you all the wrong information. So validation, correct information, these are the key factor for further mode of treatment. Suppose a diagnostic thing says a person is diabetic as per this thing, and he is treated for, and then suddenly he goes for hypoglycemia. It may be a very crisis situation. Here, I understand this is very good tool for screening and guiding the, all the periphery. Besides the internal, I'm not talking about city clinicians, etc., because my main issue is related with secondary level of healthcare
Mm-hmm.
and primary level. These are the area where such tool are going to be a real, support, I can say, and a great deal. You know very well that in the rural area and the district area, there is a shortage of doctors and other problem, and this will be a great clinical assistant. Even one doctor can handle many of such cases in a very close to the precision. My only concern is your data has to be based on our Indian parameter. Then only you will be able to get, because region wise, there will be a variation. A southern area, the kind of, their habits and this thing will give you the result. And similarly, in the northern region of the country, there are different parameters. So these are our findings. That is the reason my concern is, it's always good that in our country, the biggest shortage or problem is the data, and that too, validation of data is another issue. Because in government, we are working on health card. Now imagine
Mm-hmm.
health card and PM ABHIM, which we are working on. In this area, we need definitely support of AI like this only. But only thing is how people have to develop a faith. And for that, if you do a little more homework on these parameters, if your data are totally based on Indian, I'm not denying that. You must
Mm-hmm.
have done a lot of work on that, but it
Yep.
has to have more support from Indian parameter than the European and American. That is the only thing where I feel there is a little my apprehension. Rest I
Right.
could see it is doing a wonderful thing. At least a person does not keep guessing. He is at least in a direction. And also, whether he needs an hospitalization or whether he can be handled within their clinic or wellness centers, etc., will be a great boon because presently, the techno-based approach for us also reduces the size of infrastructure and the cost of the infrastructure unnecessarily, because COVID has taught us that you can have a telemedicine and all the online support system, and particularly now for geriatric care, we are already taking care of these parameters in a big way in the online support. So I think it's a good move. Only thing is I need this kind of a support so that I can take it forward, in a
Okay. Yeah.
wider
Yeah. Yeah. Yep.
perspective, because
Right.
first
Right.
I must be convinced in 100% so that I'll be able to convince my ministerial people to, because this is the need of the hour.
Right. Right.
And
Yeah.
thank you.
Yeah, thanks for that, Dr. Chandrasekhar.
Thank
Thanks
you.
for joining for the call also. And another point, you mentioned that about the reports. So what we do right now is we don't, motivate people or kind of suggest that they can upload directly the images. Instead, they can upload the reports of those images. Like you can't upload the radiograph, but the radiograph report, which has more different information that the model can refer to. So that is another like clarification I need to make. And yes, on the Indian data side, yes, I will definitely we as a company we will work towards that and keep you in loop also on those things. So yeah, I hope we have covered everyone's questions. um, yeah, okay, so I think yeah, we are over time, so we will kind of conclude today's session. It was a uh, good, I think, discussion also we had right now with Dr. Chandrasekhar. And yeah, so I think yeah, so thanks for joining. And yeah, we will keep on having such sessions, and please like be a part of it for the next times as well. Yeah, thanks for joining, everyone.
Thank
Thank
you.
you.
Yeah,
Thank you.
thanks. Bye.
Bye. Bye.